Good morning all. So we will be first dealing with the case. She is a 26-year-old G2 second gravida with first abortion. She was on regular antenatal checkup with no other complications during the antenatal period, and she came with the pain, and on examination the uterus was firm, cervix was uneffaced and was closed. She presented at 26/12 at 5:30 p.m. with the pain abdomen. The cervix was 75% effaced, 2-finger loose. She was accelerated with oxytocin, delivered at 7:55 p.m. a 3.6 kg baby. There was traumatic postpartum hemorrhage. There was cervical and vaginal tears were sutured. Again, by 8:40 p.m., the uterus was flabby. There was profuse bleeding and hypotension. The patient was shifted to the theatre and a subtotal hysterectomy was done. 8 units of blood and 1 unit of FFP was given. But around 1:15 a.m., the patient was transferred to a higher center. But on the way, the patient died. So this is another case of postpartum hemorrhage resulting in death of the patient. So as you have seen from these cases, the risk of maternal mortality and morbidity is increased about 50 times after a postpartum hemorrhage. It is a single most important cause of maternal death worldwide. It accounts for almost half of all postpartum maternal deaths in developing nations. The Foxy says that obstetric hemorrhage is responsible for 38.2% of maternal deaths, and this postpartum hemorrhage is a reason in 35.2% of cases. What are the learning objectives? What is PPH? What are its different types? What are the risk factors for postpartum hemorrhage? How can you prevent it? And how can you identify? So traditionally the definition says that blood loss more than 500 ml in vaginal delivery and more than 1000 ml in cesarean section, or any amount of blood loss which results in hemodynamic instability or a fall in hematocrit of more than 10%. This is a definition of postpartum hemorrhage. What are the different types? So we can consider the 4 T's, that is tone, loss of tone or atonic. Then tissue, that is retained products inside the uterine cavity. Then the third T is trauma, that is traumatic PPH. And the fourth one is thrombin, that is when there is a deficiency of thrombin, a disseminated intravascular coagulation. And we can also classify into primary, that is bleeding occurring within 24 hours after delivery. And the second is secondary PPH, that is the bleeding after 24 hours after delivery within 6 weeks. And what are the risk factors for postpartum hemorrhage? The antenatal period, the risk factors are multiparity, previous history of postpartum hemorrhage, uterine overdistension, then multiple pregnancy, polyhydramnios, antepartum hemorrhage, then fibroid complicating pregnancy. The intrapartum risk factors are induced labor, a prolonged labor, instrumental delivery, precipitate labor, then when the patient is under general anesthesia.